Hi everyone, say hi to Allison Locke. She's a licensed acupuncturist, registered member of the College of Traditional Chinese Medicine practitioner, practitioners and acupuncturists of British Columbia. Wow, that's a really long name.
Yes, it is.
Allison has been on the show before, so you can refer to episode 98, where we actually talked about the use of acupuncture and traditional Chinese medicine for PCOS. I'm
Mhm.
really happy to have you back on the show today to talk about another big condition in women's health, endometriosis. So, as a stage 3 Endo Warrior herself, Allison is extremely passionate in helping treating the pain and symptoms of endometriosis. So I can't wait to dive deep into this because I think there's a lot of things that are, not known or maybe like misunderstood.
Mhm.
And also we're going to be talking about how we can treat it holistically, including the use of Chinese medicine. So welcome back.
Thank you. I'm excited to be here. And yeah, endometriosis is one of my favorite topics to talk about. So I'm really excited.
Yeah, I bet. I mean, it's also like, whenever you have a personal journey with it, it brings you that much closer
hmm
to it.
Yeah, absolutely.
So yeah, so let's dive right into it. And you can bring in your
Okay,
personal experience too if you want to.
sure.
Just let the listeners know, what is endometriosis?
Yeah, so it's basically a big word for the name of a gynecological disease that is characterized by the presence and the growth of tissue that is similar, but not the same tissue that lines the uterine lining, the endometrium, and it grows on areas outside of the uterus.
Why does that happen? Like, is there a root cause for that genetically? Like,
Yeah, so there's not a ton of research about endometriosis, unfortunately. It's getting better. So
Mhm.
there's no one definitive cause. We don't know exactly why it happens. There are quite a few different theories. And I think based on the research that I've done and everything, I think the main sort of things are, yes, there's a genetic component, and then a lot of it is it's basically a birth defect as
Mm.
your reproductive organs are developing when you're a fetus, and growing as an embryo. The tissue that is supposed to make up the female reproductive organs, like the uterus and the ovaries and the fallopian tubes, those all kind of come from the same cell, but they kind of get displaced into other areas of the pelvic cavity as the embryo is growing and developing into a human. And so that kind of plants the seeds for endometriosis to grow. And so then through whatever environmental or other kind of triggers,
Mm.
throughout life and through puberty and adulthood, somehow that gets triggered, and then lesions can grow and cause a whole bunch of issues.
Interesting. I feel like that is sort of more of a physical structure that's
Mm-hmm.
kind of leading towards the condition. Like a lot of conditions that stem from like, biological processes or lifestyle
Yeah.
factors. So that's really interesting to know. What are the symptoms of endometriosis?
Yeah, so the main symptoms are painful periods. There's also a lot of non-cyclical pelvic pain, so a lot of pelvic pain outside of your period. And then there can also be painful intercourse, pain with bowel movements, pain with urination, fatigue, infertility. There's often a lot of digestive disturbances, a lot of that kind of stuff.
I think that's a lot of pain in the lower
Basically, a
region.
lot of pain. Yeah, pain is
Right.
the number one symptom of endometriosis, that's for sure. But it's kind of funny because a lot of, I mean, not funny, but a lot of people that have endometriosis also don't have a lot of pain too. And so that's kind of how a lot
Mm.
of people are underdiagnosed and not given the right care because there's so many different symptoms of endometriosis, but also it presents so differently in each person that it can be really hard to identify.
Interesting. I used to work with a coworker before, and I think she had endometriosis, but at that time I
Mhm.
didn't know what it was. But she would like bowl over in pain all the time, every month,
Oh,
and she would have to like
yeah.
be wheeled out. So I imagine that the pain is quite hard to deal with.
Yeah, it can be really bad for an unfortunate number of people, and it's extremely common. Like I think one in 10 women have endometriosis. So it's an extremely common condition. So a lot of people are probably walking around not knowing they have it or not getting properly
Right.
diagnosed, properly treated, and yeah, it can be really bad for a lot of people.
So, personally, how did you get diagnosed with endometriosis? Like if it's really common and like, sometimes
Mhm.
painful cramps are also like an acceptance, right, in our society, like, oh, it's supposed to be that painful, but it really
Yeah.
isn't.
Yeah. Yeah. So I was actually, I did not know I had endometriosis for the longest time, even after I became an acupuncturist and specialized in reproductive medicine and fertility. I still didn't know I had endometriosis
Oh,
for quite a few
wow.
years. So yeah, it's kind of funny. I ended up being diagnosed with the disease that I treat every day in clinic, which is pretty serendipitous. But I basically went to a walk-in clinic to get my iron levels tested because they've always been historically low. My doctor asked me a few questions about my menstrual cycle. I mentioned it can be a little bit irregular sometimes. So she said, let's just do a pelvic ultrasound and see if there's anything going on. And I'd never had one before. So I thought, sure, why not? And then through that pelvic ultrasound, I ended up having a cyst that was later diagnosed to be an endometrioma, which is a specific type of cyst that only occurs with endometriosis. So it's basically endometriosis growing on the ovary in the kind of cyst form. And so that was how I ended up being diagnosed.
Wow, so you didn't have any of those like painful symptoms, like really painful
Not a
cramps?
ton, no. Yeah, no, my periods have always been fairly manageable. Just slightly irregular, but it's actually gotten a lot better the past couple of years. Yeah, they're not too heavy. I don't have a lot of the symptoms. So I'm kind of part of that subgroup of
Right.
endometriosis sufferers that don't have a ton of symptoms. And it's fairly like they call it like asymptomatic or silent endometriosis.
So when during the introduction, you were considered a stage 3 endo
Mhm.
warrior. So I love the warrior term, by the way.
Yeah.
So can you explain a little bit about the stages? Like what's stage 3 compared to like 1?
Yeah, that's a really good question. So there's 4 stages for
Mm,
endometriosis, and it's basically characterized. You have to get diagnosed stages through surgery. So it's basically when the doctors go in with their little cameras and they take a look around, and based on their findings, you're categorized into one of the 4 based on the severity, the amount of lesions, where they're at. So small lesions that are just kind of dotting the peritoneal cavity of the pelvis, that's just stage 1. Stage 2, maybe there's larger lesions. If there's anything on your ovaries or really large lesions that are like on your digestive system or a bunch on your bladder or stuff
mm,
like that, then that will be characterized as stage 3 and 4. And so mild to moderate is like stage 1, 2, and then severe
mm,
is typically stage 3, 4. And because I had a very large cystoria on my ovary, I was
right.
categorized as stage 3, debatably stage 4, but I feel like I'm more stage 3.
Oh, interesting. So, the endometrium can also grow on like various organs that are not in the reproductive system. Because you mentioned like the bladder
Yes.
and like, oh,
Yeah,
okay.
yeah, exactly. Pretty much anywhere in the pelvis. And
Okay.
I think officially endo has been found on almost every organ system of the body. Like it's been found
Mm,
on the lungs, even on the brain. I
that's
think just this
crazy.
past year, it's been found on the spleen. So like
Mm.
everywhere in the body, it's so it can just really get into everywhere.
So when you're faced with like, this sort of condition where it can grow anywhere,
Mhm.
what are like the current treatments for it? Like what are the pros and cons of like the treatments?
Yeah, so there's not awesome treatments for endometriosis currently. So,
Okay.
one, painkillers, obviously, because it's a
Right.
painful condition. We usually
Yeah.
need painkillers to get through our day, get through a period. The second most common treatment method is the birth control pill, which doesn't work for a lot of people with endometriosis because you can still get a lot of symptoms with it. Just because you're not having like an actual menstrual period, you're just having the withdrawal bleed from the birth control pill, which can be, less symptomatic than a
Mm-hmm.
regular hormonal cyclical period. You're still bleeding, and that can still irritate the lesions. And so it doesn't always work for everyone with endometriosis. And then there's also some other hormonal medications like progestins, which is synthetic progesterone, which can help sort of balance out the estrogenic effect of the endometriosis lesions because estrogen kind of inflames and aggravates the lesions. It kind of causes them to grow. It's kind of like fertilizer. And then progesterone kind of helps dampen that a little bit. And so sometimes progesterone-based medications can help balance out sort of the estrogenic effect of the endometriosis lesions. And then there's a whole class of medications that put your body into chemically induced menopause, like Lupron or Alyssa. And these medications like severely lower your estrogen levels, which can have a lot of really detrimental effects on your body. And you get a lot of side effects. And so a lot of these medications are really not tolerable by a lot of people. And then there's surgery, which is, laparoscopic excision surgery is considered like the gold standard of treatment for endometriosis. So actually going in and removing the lesions is probably the best thing you can do if you have a lot of symptoms, a lot of pain, because medications cannot make the endo lesions go away at all. It can help shrink them a little bit, but as soon as you stop medications, they grow right back. And so surgery is one of the best treatment methods because it actually gets rid of them. And yes, there's debate of, can it grow back? Is it super successful? How long does the surgery? How long are you get relief from the surgery? So there's a lot of debate and confliction about that. There's not great results and research from those studies, but it does seem to be way more effective than treating it with medicine. So that's kind of like the Western medicine side of how endometriosis is often treated.
It kind of makes sense because it is a structural component. So I guess surgery would make sense. I do have a quick question. So it kind of grows in like different areas. Like, does that actually affect? I assume it actually affects your hormone levels. And that's why you would get like irregular periods or like the other symptoms as well. Yeah,
definitely. So hormonal imbalances is definitely a really common thing with endometriosis. So estrogen is kind of what helps the endo lesions grow, but also endometriosis, those lesions in your pelvis, also secrete their own estrogen. So they're kind of like self-proliferative. Yeah, it's kind of a really horrible cycle of more estrogen, more inflammation, more estrogen, more inflammation. And until you kind of get the hormone balance and inflammation under control, it can really spiral out of control.
Now I'm really curious how we treat this holistically. As you're giving me all this info, I'm like, what is this map can I create? Like, do we address the estrogen and then like the progesterone? Like, walk us through how you would treat this like holistically.
Yeah, so there's a lot that you can do to treat endometriosis holistically. And the number one thing is, because it is primarily an inflammatory disease, the number one thing you can do is reduce inflammation in your body as much as you can. So reducing inflammation, and then other things like regulating the immune system and then balancing hormones. Those are definitely the three main things that I look for in a treatment plan with my patients. So reducing inflammation, that looks like an anti-inflammatory diet, a lot of anti-inflammatory herbs and supplements, focusing on gut health and your microbiome, keeping your blood sugar stable, regulating your nervous system. So there's a lot of diet lifestyle things you can do to reduce inflammation, which I find really helpful for a lot of my patients. I definitely target the digestive system a lot. And so people with endometriosis, we have a bit of different microbiomes. We have a bit more of the bad bacteria and less of the good bacteria. And so our microbiomes are not optimal. So if we kind of help balance out the good and bad bacteria, that will really help with leaky gut and reducing inflammation all over our body and helping to balance blood sugar, and reducing like common gut infections like SIBO, parasites, candida, like treating those kinds of things and really optimizing the gut, I find really, really helpful for treating endometriosis. And then of course, for the hormone balance part, we need to make sure that your body's properly detoxifying excess levels of estrogen. So your body, you want to reduce estrogen. It's really good for a lot of things in your body. It's good for a normal, healthy, regular menstrual cycle, and for your bones and for your heart and skin and a whole bunch of other really good things. But after your body's done with it, you want to make sure you can properly excrete it so it doesn't get reabsorbed into your body and then just causes a bit more of those estrogen dominant symptoms that I often see with patients with endometriosis. And so this means really optimizing your liver health so your liver can properly detoxify, and then making sure your gut health also is really good. So that phase 3 of estrogen detoxification is really efficient too.
That sounds so aligned to a lot of approaches in functional medicine, even when you know, like addressing other conditions as well. So I'm really glad like you kind of laid that out. You know, you talked about the anti-inflammatory diet for endometriosis. My question was, is there a diet for it? But I'm guessing like that's just kind of where it's at, right? Like just reducing inflammation, and putting in all the good stuff, like the vegetables and the fruit that gives the body like a break from inflammation.
Yeah, definitely. That's a very good question, because there's no one diet for endometriosis. There's always, you know, the endo diet kind of being thrown around on like the internet and social media and
There's
everything.
a lot of diets being thrown around.
There's a lot of diets. Yeah, diet for this, diet for that.
I
but
know.
The thing about diet is that it's so personal and unique to the individual, because what is great for one person can be awful for another, and that can be, you know, the macronutrients, how much protein, carbs, and fat that you're eating, but also like really specific other things too. So yeah, there's no one diet for endometriosis, but I generally recommend an anti-inflammatory diet. So that means removing pro-inflammatory things like sugar, alcohol, coffee, dairy, poor quality oils, a lot of fried greasy stuff, and then increasing anti-inflammatory things. So lots of, fruits and vegetables, leafy greens, all the healthy oils, those that I find really, really important. And always working on blood sugar stability. Even if you don't have any signs of diabetes or PCOS, I find working on stabilizing your blood sugar throughout the day. So eating your regular 3 meals, not skipping any meals, making sure there's lots of good quality protein and healthy fats with each meal, can really help with regulating inflammation levels, because when your insulin's like spiking and going all over the place throughout the day, so do your stress hormones, and then so does inflammation. And so I find keeping your blood sugar stable throughout the whole day is really, really helpful for helping any kind of chronic pain syndrome.
That's a really good tip. I'm really glad you brought the blood sugar thing up, because you know, it's also really affected by stress, and stress can really cause our glucose to go up and also rise, and people can get like insulin resistance just from stress alone. So that's a really good one to know.
And it's often not caught until it's like too late, and it's like, oh, actually now you're pre-diabetic, when there's actually so much we can do to help maintain healthy blood sugar throughout our lives, and being monitoring it regularly too.
That's so true. So how does, you know, in your realm of traditional Chinese medicine, how does that and acupuncture actually help with endometriosis?
Yeah, so acupuncture is definitely one of my favorite things for using to treat endometriosis. And that's because it really communicates with the nervous system to release, you know, the pain relieving neurotransmitters. It's really anti-inflammatory, so it helps support the immune system. And we know people with endometriosis have a bit of a wonky immune system that needs a bit more support. It's really good for increasing healthy blood flow, regulating your hormones, helping with the digestive system. So there's so many mechanisms of acupuncture, and then how it translates into helping the bodies of people with endometriosis. So yeah, acupuncture is one of my favorite tools for endometriosis.
That's oh, your dog's so cute.
Sorry, my cat's making an appearance.
That is so cute. As well, sidetrack. So like, you know, acupuncture use, do you, like, if someone is feeling pain in a certain region because they have like a lesion there, that's like, you know, do you like do certain acupuncture points in that region only, or is it just like a whole general thing?
Yeah, that's a really good question. So I definitely love doing like local points over the abdomen. For people with endo, I find it really, really helpful for the pain and the bloating. But then I definitely do a lot of distal acupuncture too. So that means a lot of points on, there's some good pain relieving points on the hands. I do a little bit of master dong acupuncture, which is, there's a lot of good finger points that help a lot with hormone balance and reproductive disorders. There's a lot of good leg points that I also find really helpful for kind of like reducing kind of the uterine contractility and like the high prostaglandins that cause a lot of the period cramping and the period pain. So it's definitely a full body treatment. And then I'm
Awesome.
always working on regulating the nervous system, reducing stress, because endometriosis is a really stressful condition, and anything that you can kind of do to calm the stress hormones is really going to help with pain too.
Very nice. I think that's very logical in the way you assess things, alongside with all the nutritional, uh, tips that you offered earlier. So are there any other aspects of Chinese medicine that you use to treat endometriosis, like, like using herbs or other techniques?
Yeah, I definitely do love using herbs. So I do a lot of Chinese herbs for my people with my patients with endometriosis. I do find it really helpful for kind of supplementing in between acupuncture sessions.
Right.
And so I do a lot of herbs that will help a lot of movement. So endometriosis in Chinese medicine, it's usually because a lot of things are stuck, and that can kind of make sense because there's physical lesions that are blocking,
Right.
the circulation and the flow in the pelvis. And so I do a lot of like breaking up the blood stagnation and breaking up qi stagnation, warming up the meridians and stuff. I find that's really helpful for a lot of people with endo, and especially if they like can't come in for acupuncture very often. I find the Chinese herbs like really good for in between sessions to really help keep up the momentum that we're building.
Okay. So if someone's listening to this and they want to come visit you, also, are you seeing patients like in person only because of the acupuncture, or do you do like
Mhm.
remote work as well? Like, how can they find you?
Yeah, so I am currently only licensed in British Columbia.
Got
So
it.
I can see people in person in the clinic that I work at in Vancouver.
Mm-hmm.
I'm also able to see people virtually if you live in BC. I'm trying to work on expanding my reach a little bit. It's in the works. I'm
Nice.
still working out licensing and liability insurance and stuff. So I'm hoping sometime this year to be able to see people virtually, no matter where you are.
Mm-hmm.
And so yeah, virtually you don't get the actual physical acupuncture component, but there is so much that you can do besides just acupuncture to help with endometriosis. I find it's just like one of the awesome pillars that helps reduce symptoms and reduce pain, but there's also just so much else that you can do. So I
Right.
do find virtual consultations when you're treating patients with endometriosis still really beneficial.
That's awesome. And also let the viewers know where they can find you. I love your Instagram, that's why.
Oh, thanks. Yeah, that's where I hang out mostly. I'm Sea of Chi Healing on Instagram. I just redid my website, so that's seaofchihealing.com. You can find more information there, and I've got some resources and contact info and stuff there. And yeah, I do try to respond to all my DMs on Instagram and try to help people find local acupuncturists and stuff local to them that can help them, or any referrals and stuff. I always do my best to try to help.
Yeah, awesome. I mean, I think if someone's listening to this and they really need help with endometriosis, I'm going to put all the links in the show notes so they can come find you. Thank you for coming back. That was a really great conversation.
Yeah, thank you for having me.